Good morning. Thank you all for attending City and State's 2020 Central and Western New York Virtual State Legislative Forum. I'm Zach Williams, State Government Reporter for City and State. We've already had similar forums like this on Long Island and the Bronx. And we got a great group of state lawmakers and advocates here today to talk about everything that is happening on topics like nursing homes, long-term care, family caregiving, prescription drugs, affordability, and financial security. But before we get there, I want to thank our great sponsor, AARP New York, for helping us put on this event. We got Randy Hoke here to help kick things off. He's the Associate State Director for Engagement in Western New York for the AARP New York. In this role, he is responsible for community outreach, advocacy, and livability. Randy?
Good morning, and welcome to City and State's Central New York State Legislative Forum, sponsored by AARP New York. I'm AARP Associate State Director for Central New York, Randy Hoke, and I want to thank all of you for joining us virtually today. In a few moments, Zach Williams of City and State will introduce our special guests. These are your state legislators who represent you and your neighbors from Central New York in Albany. Zach will introduce each legislator, then launch right into questions so we carve out as much time as possible to hear their positions, plans, and priorities on issues important to the 50+. I want to emphasize that AARP is a nonpartisan organization. We do not contribute to political campaigns. We do not endorse political candidates. The purpose of today's forum is solely to educate our members and our participants on issues of importance so they are better informed citizens. If we were all gathered together in a big room like we used to do, I'd ask for a show of hands. How many of you have a loved one in a nursing home? Or how many of you care for an older family member or loved one at home? Or take one or more prescription drugs regularly? I would imagine a lot of hands would be up. Nursing home conditions, family caregiving, and prescription drug costs are leading issues for AARP. Today, we'll be asking our state legislators what they're doing or plan to do about those issues. I want to thank our volunteers and members from Central New York who are in virtual attendance today, and I want to note that they are key to what we do here. That includes, as I know our state legislators can attest, showing up in their red shirts and making sure our state legislators are aware of and responsive to the needs of the 50+. I'm sure they and all our members will be listening carefully and are anxious as we are to hear from our lawmakers. With that, I want to thank City and State for hosting this forum and turn things over to Zach.
Thanks, Randy. So as he said, we got a great group of lawmakers here. I'm going to introduce them one by one. Panelists, please just give a wave so everyone can put a face to the name. First off, we got Senator Rachel May of the 53rd District, State Senator Thomas O'Mara of the 58th District, Assemblymember Marianne Buttenschon of the 119th, Assemblymember Al Stirpe Jr. of the 127th, Assemblymember Donna Lupardo of the 123rd, and rounding things off is Assemblymember Robert Smullen of the 118th. And batting cleanup for us is David McNally, the Manager of Government Affairs and Advocacy at the New York State AARP. So we got a lot of great topics to cover, such important issues, especially with the coronavirus pandemic, staging a comeback of sorts in the Empire State, and the state budget process coming up, and what could be a very tough year for New York. So, for seniors, many of them are living on fixed incomes, and staying in their homes, especially in times like this, can be more important and challenging than ever. I think just to start things off with the budget process looming, I would like to just ask each of you, state lawmakers, that is, how will you protect, home and community-based funded programs through the State Office for the Aging, such as home delivered meals, transportation services, and other supports that help older people stay in their homes in the upcoming months and years? I'm just going to start things off with Assemblymember Lupardo.
Surprise. Your drink, Donna.
I thought you were going to go with Senator May as the chair of the Aging Committee, so I don't want to certainly work on some of the things she's going to say, of course. But well, first of all, thanks for having us here. It's really a pleasure to join AARP today with my colleagues. We're all good friends, and we work very closely together on many of these issues. As the senior member, I mean, in age at least, in this group. I used to chair the Committee on Aging when I was in the Assembly, and we really focused primarily on home care. It was something that we had to work very hard to convince our colleagues, of course, that were bought in, but and the governor and everyone else to prioritize this in terms of budget. So the goal is to protect the funding and make sure that we continue to make the argument that, you know, any investment made in home care is a long-term savings all the way around. I chair the Committee on Agriculture now, and I'll be happy to talk later about food insecurity and all of the things that we're going to be doing, you know, to make sure that our food supply chain remains robust. But I can tell you that home care services will be at the very top of our list in terms of priorities, not only because it's the right thing to do, because it saves a lot of money in the long run.
State Senator May, you are the chair, as the Assembly member mentioned, of the Committee on Aging. You know, what do you think needs to be done to protect programs like this from cuts in the upcoming months?
Right. So we've, for the last 2 years, done a lot of advocacy to make sure that there weren't cuts to these programs. But this year, the pressure is going to be much greater, clearly. And the need is also greater, the need for home delivered meals and the need for home care when people are avoiding nursing homes and that sort of thing. There are a lot of needs in addition to all the just safety needs for PPE and that sort of thing. My colleagues, there's another press conference going on right at this moment about raising revenue. I ran in my race, and many of us did, on the idea that we do not want to balance the state budget on the backs of the elderly, on the backs of people who are struggling during the pandemic, or on the backs of middle-class families by raises in their property taxes. So we are talking about a number of revenue-raising options in order to plug the hole in the state budget, mostly that involve raising marginal tax rates on the very wealthy and some other mobile sports betting and a number of other options that could raise revenue for the state rather than having it go to neighboring states. So we are going to be trying everything to make sure that we're not cutting the essential services that the elderly require.
Now, Democrats and Republicans obviously have very different philosophies on taxes, but, you know, social supports for seniors is an issue where Republicans and Democrats often work together, especially in the state and local levels. Senator O'Mara, Republicans sometimes have to pick their battles in the state legislature, but could you tell me a little bit about, you know, what you and other members of the minority are going to be doing to help protect programs for seniors and help them stay in their homes?
Yes, thanks, Zach and Randy, for putting this together today and having us on. Excuse me. You know, this is not a fight that you're going to see between Republicans and Democrats on caring for our elderly. I think we have seen the cost efficiencies of keeping people in their homes and as much family support as possible. Saves money and provides a much greater quality of life for our seniors. I, for one, think that our nursing homes should be a place of last resort almost to have to go. I'm looking forward at ways to improving delivery of services at home, whether that's as simple as meals, which is needed these days, as has been mentioned, but also you know, the programs that, and I looked this up yesterday and I forgot what it's called now, but you know, providing compensation for family members to provide these services for family members that's been threatened to be cut over the past few years. So looking to certainly retain that and hopefully grow that so that we can have individuals in their homes for the fullest extent possible. And I think access over time to prescription drugs certainly helps keep people healthier over time, and will help in the long run keep them out of more expensive nursing home settings. Those are a couple of my priorities, at least to help build a better ability to keep people in their homes and with family members.
Assemblyman Smullen, are you feeling the same thing in your conference in the Assembly?
Well, absolutely. You know, when you think about what the social contract is between New Yorkers and their state, and one of the two groups that we always want to make sure that we prioritize to take care of our seniors and our developmentally disabled folks. So, you know, when I look at these issues and relative prioritizations in the budget, and I look for areas where we can do savings, where we can not spend money that we don't have on things we don't need. It's not in seniors, and it's not in our developmentally disabled communities. We've got a big heart and a big sense of what's right and wrong, and we're looking very much forward to this budget season, because we do have some serious structural problems in our deficit that cannot be corrected by raising taxes. So it's going to cost some hard choices, and we're looking forward to that dialogue and standing up specifically for our seniors.
Zach, if I could, first, thank you to all of our legislators for joining us today. Central New York is I kind of feel like I'm home. I've spent a lot of time in Central New York growing up and with AARP. I want to first acknowledge Assemblymember Lupardo, who was our aging chair champion for years in the Assembly. It's great to see you, and I thank you for all of your past support in these efforts. And of course, to Senator May. We couldn't have gotten that $15 million to help end the waiting list over 2 years without your leadership in your House. So thank you to both of you, and for all of you who have supported that effort. Unfortunately, the need is greater than ever, particularly with the pandemic. We're seeing that $15 million over 2 years was to help kind of ratchet down all the waiting lists for home and community-based services. We're seeing numbers now that the waiting lists are up to 12, 13,000 people. Certainly a lot of that is about the pandemic, but a lot of it is just as the community is aging, and people don't want to, as Senator O'Meara said, nursing homes are the last resort for everybody. And so they wanted to stay in their homes. And as Assemblymember Lupardo said, it actually saves money in the long run, and it's where people want to be. And we know people are healthier and happier in their own homes and communities. So I want to thank everybody for their past support for this. And we all understand the economics of the day, but even in the worst of economic times, priorities have to be made, and there can't be any higher priority than supporting older people to live as independently and healthy as possible. I mean, these are people who have paid in all their lives. They've been part of their community, and even in the worst of economic times, we argue that these are the people that should be first on the list to make sure that they are cared for and they can live independently as possible. I also want to mention, I guess we'll talk about, Senator mentioned drugs earlier, and I know we're going to get to drugs. I'll wait on that. But again, I just want to thank everybody. Such a critical moment for us. Thank you.
And Assembly members Buttenschon and Stirpe, maybe you could just offer a couple more examples of, the types of community services that you're seeing being especially vital to help seniors stay in their homes.
Well, I want to thank City and State and AARP for hosting us today. And as Randy opened and asked those questions, saying if we were in a room, put your hand up, my hand would have gone up in every aspect, because I do have family members. And to your point of what is crucial is the importance to ensure that, as so many have stated, that individuals can stay in their home as long as possible. And I have two examples that I can say that staying in their home is an answer, but the services that they need have to continue. We talk about isolation in nursing homes. Well, we see isolation in individuals' homes also. So those Meals on Wheels are not just a healthy meal, but they're a socialization, even if it's through a door. having that conversation with that individual. So the support services that can be very cost effective are the ones as an individual is within their home, whether it's even the medical care of a nurse coming in, someone drawing blood, whatever needs to be done. And I think it assists also, the important component is our telemedicine. So that so many times we find that we can ensure as this individual's in their home, they can have that office visit and then possibly follow up with the support services. So crucial, absolutely. So thank you again.
Hi, Zach. And, I agree with everything that Marianne has said. You asked before, how are we going to protect it? It's pretty, I can give you the technical process where I think we're going to go through. And the first thing we're trying to do right now is fill an $8 billion gap. And you can't fill that in any one way. We can't just do it raising taxes or making cuts or anything else. I think it's going to be a combination of many things. And one of the things, hopefully we'll get some help from the federal government. It doesn't look like we're going to get a lot, but we'll get some. And we'll have to borrow some money. We will have to make cuts. And the process is you're going to go sit in our Zoom conferences now, and sort of have all the most critical programs sort of rise to the top. When people talk, staff is taking notes, and those subjects that get spoken of the most are going to be the ones that are the priority subjects. And, I'm sure that, as Member Smullen said, that seniors and people with developmental disabilities is going to be there at the top with other things like education and healthcare. So, we're going to bring those things up to the top. We're going to craft a way that we can fill the gaps so that, what we promised in the budget that we passed last March or beginning of April, we are able to do for all these different organizations. And, later on, like Donna said, we'll talk about food insecurity. And that's probably one of the more critical issues we find around seniors. And I know that right here locally, our Meals on Wheels program is just, exploded, and it's almost doubled the number of seniors that it had been serving prior to the pandemic. So we've got to make sure that if we're going to take care of seniors, the food supply is taken care of. And, we had lots of problems when this first took place in March and April. We've spent a lot of time and a lot of hearings trying to figure out how to make sure that New York State's able to be more flexible with what foods, how it processes it, what sizes it can put it in, so that it can actually be used by organizations and all these different programs. So there's a lot of work ahead of us. It's not going to be fun. People don't run for office to go cut programs that they really love, but unfortunately, we're going to be doing a lot of that this year. And but I think that seniors and the disabled are going to be much closer to the top of the list than other programs.
Can I jump in here for a sec? So 2 years ago, when we were able to fight for that 15 million addition that Dave mentioned in the budget, that was for getting people off of waiting lists for home care. And it went along with another budget item that the governor put in that was a $34 million savings, I think. So investing 15 million was recognized at that time as saving more than twice that amount in keeping people out of nursing homes, because the Medicaid costs to the state are much higher when people go into nursing homes. So I'll be fighting this year to make sure that we're doing that kind of whole system accounting again, so that since the waiting list still exists, we want to make sure that we're making that investment up front so that we're getting the savings down the road, and so that it is reflected in the way the budget is designed. Because I think too often we hear from people, you know, you need to invest here because it's going to save there, but we have no mechanism for reflecting that in the way the budget is put forward. And I think in this case, we have a precedent for it. The governor did it 2 years ago. I think we can continue to do that.
And I want to let you all know that coincidentally, today, a letter is going to the governor signed by 158 organizations urging him to make sure this is a priority in the budget. And I think in the letter, we list 11,000 on the waiting list, and we all know that number is only those that are reported on the list. It doesn't account for the thousands of people who either are eligible and don't call, or they don't get put on the list because they need the services more quickly than they're going to get them. So 158 organizations, press release going out today, and off to the races we go, we hope, with all of your full support. So thank you for that.
Great, I'm glad to hear it. And I'm wearing my AARP red because AARP has been such a champion for these issues.
You know, another pocketbook issue is utility costs, you know, electricity, gas, water. You know, how can New York better provide relief for its citizens from high utility costs beyond that shutoff moratorium that the governor signed into law, covering the pandemic and 6 months later, especially with such a cold winter coming up? Who wants to jump in on that one?
I'll start off on that one. Well, I mean, the first thing is we all came together to fight this rate increase that was proposed, not only NYSEG, but I think Rochester as well. And we at least were able to get involved with that rate case and keep that increase low, which was very, which is very positive. But there's another, you know, I like to think of the internet or broadband or as an essential utility that we really haven't fully prioritized. And I know how important connectivity is to not only to seniors, but now we're seeing to students and people who are working from home. So in addition to setting our, you know, priorities, clearly, you know, broadband expansion is going to be very important as well. And it's becoming honestly an essential utility that we're going to have to focus on. And I think it was already mentioned about telehealth. It's kind of hard to, you know, to take advantage of telehealth if you don't have that kind of connection. And if there's a silver lining in all of this, is that people are beginning to see that we can expand healthcare services into rural areas and other underserved places through telehealth. That is, I think, has enormous potential going forward. So we've got a lot to do, but the pandemic has exposed some weaknesses in the system that many of us have talked about for a long time, that I think we're going to be able to focus on and prioritize.
Expanding broadband access seems like something I've heard Republicans get behind before.
Yeah, thanks so much, Zach. That's going to, for me, that's going to be a big legislative push this year, is to expand broadband access. And one specific area, at least in the district that I represent, that's very important, is so all citizens can do telehealth, but more importantly, seniors. So here we are as winter is starting, and wouldn't it be great to be able to FaceTime up with your doctor and be able to talk about the issues that you need to without having to go either to the local satellite clinic or travel, you know, 30 or 40 miles to the nearest hospital. So that's one of the things. It's a federal and a state issue, but I'm going to do all I can at the state level to put a big emphasis on broadband, because this pandemic has really pointed out how important it is. And although I don't think it necessarily needs to be a public utility, we've got to eliminate the regulatory hurdles at the federal and the state level to be able to incentivize all those providers to get that service out to all of our citizens above the FCC 25 megabyte per second minimums. That's really key. And once we do that, you know, all things are possible from a telehealth and telemedicine standpoint.
Yeah, it might be counterintuitive that during these really tough economic times, we're going to put money into a program like broadband. But if we're going to do, as the governor said, build back better, you know, we've identified something that's definitely caused a lot of problems for a lot of New Yorkers. And it's an area that I think if you're going to make some investments, that's one of the best areas we can do that. So how we get these companies to go ahead out into the more rural districts, and like you say, that's why the Republican members are as much or more for this than we are, because most of their districts are out in less populated areas. So we really need to do something to take care of people who aren't in the metropolitan areas, and this is going to be one of the keys, I think.
Yeah, thanks a lot, Al. I really appreciate you saying that. And I just want to follow up. I think this broadband issue is like the post office was in the 1800s or rural electrification was in the 1930s,
right,
where it's an essential service. It doesn't necessarily have to be a public service. UPS and FedEx, deliver mail cheaper than the postal service. But to make sure that it gets out there to everybody, there has to be a concerted effort at the federal and state level.
So in addition
I would
to
echo-
chairing the Committee on Aging, I also chair the Legislative Commission on Rural Resources, and we held a hearing about broadband last year where we heard just shocking stories about the difficulties that people face all over the state. Good news, right now, a lot of my New York City colleagues are getting in touch with me and saying we're seeing what the digital divide does to our children in schools. We're seeing it just how important things like telemedicine are. And we want to get on board with really making sure that everybody has internet access around the state. And I have a couple of bills to facilitate municipal broadband, which is a solution that's working in other parts of the country. And I think we need to explore that here so that local governments can kind of bypass the big telecoms and do their own broadband services. We need to try everything that we can to make sure that we're bridging that divide.
I would agree that that's a top priority for sure. Certainly in a district like mine that is very rural. I have Yates County in the district that I represent. And they have recently, in the last year or so, been awarded a USDA grant to do a municipal broadband build out in the county, piggybacking off what has been a dark fiber loop that was run a few years ago and around the Southern Tier and Finger Lakes region that was sponsored in significant part by Corning Incorporated and their fiber divisions. But one of the hindrances now, and I've dealt quite a bit with this lately with Yates County, is this new state fee on right-of-way access to state right-of-ways. That is going to unnecessarily add cost to these projects. And that's going to be a detriment to build out. We're already seeing that even in a rural place like Yates County, concerns over the state fee on these right-of-ways. So, it's not just as many people see it, maybe they're charging fees for running lines down the right-of-way of the thruway or interstates or major state highways, but it's every state route that's going across the state, which often are the most direct, the direct routes to run this fiber. And that's critically important that we not put up a barrier to add costs to building this out.
Zach?
I think that as Assemblymember Lupardo discussed was the importance of those rate increases, even for our gas and electric, and in so many areas, and ensuring safe drinking water. So we find that the utilities has, when you talk about it, is such a broad discussion because of those basic needs of individuals as the winter months are coming. And many call our office and requesting any type of assistance for those basic needs and the costs that they incur. And I know that AARP is continuing to advocate for that also. So I thank you for that.
If I could jump in, Zach, I want to thank all the legislators for voting for a bill that passed I believe unanimously in both houses. I think there was one no vote, and it is now on the governor's desk, and it would require the Public Service Commission to look into all this. If you ask the people in charge of this of the state, they'll tell you 98 to 99% of the state has access or availability of high-speed internet access. Yet we hear from members all over the state. We elected
Not
officials,
true. Yeah.
we see elected officials commenting in the media all over the state, and coming from a town of 800 people, yes, it's a rural issue, but I can tell you in New York City, we've heard stories about city council. One city councilor told us she had to go get a file of FOIL to prove that one building that said they had it because that census block was counted as having it did not have it. So it isn't an issue. It is an issue all over the state. And the first thing we need is the right information so we can fix it. So there's a bill on the governor's desk. I think all of you supported it, that require the PSC to actually investigate where is the real service and where is it not. So if any of you are talking to the governor between now and the end of the year, by all means, ask him to sign that bill. Has there ever been a more dramatic example of how important this is with the pandemic? I mean, the assembly member mentioned social isolationism as it relates to home delivered meals. I mean, this is a key to fighting isolation. There's one study that says social isolation is as bad for your health as smoking a pack or more of cigarettes a day. So we know on the social isolation front, it's important to have this access. And certainly you all have mentioned telehealth, and we think that is the future. Of course, we think it helps people stay in their homes. Of course, we think it saves money, and it's safer. So there's all sorts of reasons why broadband and high-speed internet access is important to us. And I might also add, we are a membership organization. We have 2.5 million members in New York, but we're a membership organization of the 50 plus. And those still working members rely or want to rely on this as they work from home as well, and to stay connected with their elderly parents and with their children. So this is an issue that, in our opinion, crosses all regions, all ages, and we think it's very, very important. And for those of you who have followed our Disrupt Disparities work, there's also a huge digital divide among communities of color that needs to be addressed as well. So I want to thank all of you for supporting that bill and all the conversation we're having today about this issue.
It's like you do this for a living, David. I wanted to throw something right back at you, actually. One more pocketbook issue, prescription drugs. I know the AARP has been involved in getting more imports and banning so-called, pay for delay deals that keep generic drugs off the market longer. What do you see coming up on that front? David?
Well, we did have a victory in the spring with reining in the cost of insulin, which was one of the drugs that people were really struggling to pay for, and obviously life-saving drug. And so that was a real victory. I think it was the tip of the iceberg in terms of what we need to do. There have been threats to the EPIC program, and we have all, come together on a bipartisan basis to rescue the EPIC program whenever there are threats to it. I think this is just something where we need a lot of vigilance up front, but to react to those situations, but I think we also need to be proactive in terms of really reassessing how we pay for healthcare in this state. And I'm a very strong proponent of the New York Health Act. I think a lot of the ways we pay for healthcare are unfair and inefficient, and that there are much better ways to do it and they are done in other countries all the time. And we are way behind in America and in New York State in terms of figuring out how to make sure that people have the healthcare that they need, whether it's their drugs or their access to doctors and medical care.
And I thank all of you for your support of the EPIC program. It is frankly a shell of its former self. The education and outreach, the amount of time spent signing people up for it, there's an awful lot of people out there that are eligible and not here. I mean, not signed up that we need to work on. And there's opportunities, of course, to expand EPIC. And I know there are other senior advocates that we're working with are talking about a bill. I think they've been talking to some of you about it, and we're going to pursue the strengthening EPIC and making sure everybody who's eligible for it gets it, and talk about expanding it. But there's so many other drug pieces here. The governor put his state of the state or his budget talked about reimportation. They were going to study that. We're going to want to make sure that actually is happening. They created a board at the Department of Financial Services to look into prices. We have a bill that we've been supporting that would end pay to, well, the first bill we supported last year would shine a light on pay to delay deals, meaning big pharma goes to small pharma and says, don't put out a generic version of this and we'll pay you for not doing that. We had a bill that was supporting last session. California has had a bill signed into law that actually has successfully been upheld in courts that actually bans it outright. And so now we're talking to legislators about, instead of pushing a bill to just shine the light on the problem, to actually outright ban it. So be looking for that bill in the coming days. And so there's so much more we can be doing to stop the RX greed, quite frankly, and to make sure people are getting the drugs they need. And Zach, if I could, I don't know how many of the other panelists have real-time feedback coming in from people they work with, but I'm told that the broadband bill has not gone to the governor's desk yet, but it's got to get there in the next 21 days. So just a correction, so I not leading anyone with the wrong information.
My understanding is that the sponsors are actively involved in negotiating some changes to that bill, but that there's definitely talk about the governor signing it. I'm very,
because we've unleashed the virtual red shirts. We've had emails and phone calls and social media and some earned paid media. Maybe you've seen it. So it's good to know that there's a movement on that. Thanks for that.
Well, no issue has galvanized the state more than nursing homes in the pandemic. I might go out and say, thousands of deaths, obviously something that really, hits home for obvious reasons. And now we find ourselves in a new wave of COVID-19 cases. And, on the one hand, we need to protect people from getting infected, but we've also seen during the pandemic how social isolation in nursing homes and other related issues can take a toll as well. What can we do in the upcoming weeks and months to, help people in nursing homes?
Yeah, I'd like to jump in first to thank Senator May and Assemblymember Bronson for filing a very important bill. I'm a co-sponsor in the Assembly, and I'm sure she's going to have a lot to say about it, but I don't think people realize how critically important family members are to their loved ones who are in nursing homes. I think it's really a surprise when you find out, because of understaffing and a variety of other long-term issues in nursing homes, that these folks have been personal care providers who've been providing essential services. So the bill that I would like to see get prioritized if we go into special session or next year is Senator May's bill that would designate family members, personal care visitors or compassionate, short-term compassionate care, visitors. So I'd love to hear her talk a little bit more about the prospects for that bill, because it is extremely vital to the care of these individuals, and I'm all for seeing that get done.
Thank you, Donna. I appreciate that. Yeah, so this is a bill that is based on examples from Connecticut and New Jersey and other states where they have a system where a resident in a nursing home can designate someone as a personal care assistant, or there are different names for it, but can designate at least one person who can be effectively allowed to come in even when the nursing home is closed to visitors, so that they're getting that care that the staff just can't be always there to make sure somebody's eating or to notice some of the signs of decline that family members or loved ones are able to see. And and also just help with feeding and dressing and all kinds of things that are crucial, as well as addressing the isolation. And we're seeing people declining, cognitive decline happening just because of isolation in nursing homes, and people actually literally dying. The problem is, of course, that we've had so many deaths in nursing homes, and the governor has been so much under fire about that, that the Department of Health is extremely reluctant to let anybody into nursing homes unless there is, absolutely a guarantee that they're not going to be bringing disease into the nursing homes. And so it's a very tightrope that we're all walking on between advocating for more testing and infection control in the nursing homes, and at the same time advocating for allowing more people into the nursing homes. It's a really tough one, and I'm worried that this is a very difficult moment to try to push that bill through the legislature, precisely because this is also a moment where we're seeing a surge in infection and sadly deaths in our nursing homes again. So this is we have to keep reminding people that this is also about keeping people alive, keeping people healthy in nursing homes, in addition to the infection control. And I think we have to figure out how to do both at the same time. And I do agree with what the Department of Health assessed, that the main vectors of the disease are often the staff who are working multiple jobs because they're not getting paid enough. We need to be supporting our staff and finding ways that they can work only one job. They can get paid overtime if they are working at a nursing home, instead of going off and working a second shift at another nursing home. We need to be supporting the long-term care workforce way better than we are now, so that we can rein in any of this spread of infection in the nursing homes.
I certainly support the family member caregiver. I think it runs directly in line with wanting to keep people in their homes as long as possible, because of the benefit of being in their own homes and having that family engagement. But just as importantly, when the individual goes into a nursing home, that family engagement continue. That's one of the biggest detriments of this COVID situation has been the lack of contact of loved ones to the individual in the nursing home. And it's just led to despondency in many cases. I agree with Senator May that we have to strike a delicate balance of who we let in. But as she has said, a lot of this may be coming in from workers that have brought it in. There's no reason that that family caregiver shouldn't have to go through the same type of testing requirements as an employee to go in and out, if that's what's going to be required. I think if we had a clearer picture on nursing home deaths, and if the governor didn't stonewall anybody and everybody on getting that information, fighting every FOIL request to get it, we may have a little less concern over how this is actually being handled by the state and the Department of Health, because that's been anything but transparent throughout this, and continuing to hide that just doesn't help anybody at all. One area I think, in addition to the family caregiver in the nursing home, is our ombudsman's program, which has been woefully funded and is, it's such bare bones that I believe it has minimal impact, and it should be out there to have a lot more impact, to have an ombudsman there more regularly, to see the conditions, to help be an independent voice for the patient. I think maybe a lot of times family members are reluctant to complain about situations for fear of retribution or what have you in the nursing home setting. So that ombudsman is somebody that's independent, won't be afraid to stand up and be that intermediary between the facility and the resident to make sure that the appropriate care is being given. On the staffing, certainly that's an issue. And, you know, my thought process on the minimum wages we have in this state, which are going to be very difficult to continue to raise given the current COVID situations and the crushing impacts of small businesses. But perhaps when we instituted a minimum wage increase, we should have considered increasing the minimum wage to $15 an hour for these types of caregivers, for the LPNs, for the CNAs, to have these jobs rather than increasing the wages for fast food workers. So now we're seeing these caregivers that are taking work elsewhere because they can get paid more. That's just mind-boggling to me, and it's got the system upside down.
So I think I'll have to leave it to the center for the last word on nursing homes, because we're running short on time, but there's one kind of broad issue that I would love to hear all you respond to. One of the more interesting things that I've read in the last year or two is just how diverse seniors are. You know, teens, middle-aged people, you know, 30-somethings like me, we're all pretty close in age, but there's a big difference between a 70-year-old and a 95-year-old, or a 65-year-old and an 80-year-old. And seniors, you know, some work, some are at home, you know, are homebound during the pandemic. But, you know, they all want to have active lives in one form or another. And somebody at one of our last panels brought up, you know, what are state lawmakers doing to help support seniors who are working, want to go out in the house to, you know, go to the park or go hiking, or simply want to have a little bit of fun at home while staying active? What could be done on that front?
Well, I can jump in here because this has been a focus of mine. We've got bills to help encore entrepreneurs, people who want to start a business later in life but need support with whether it's, you know, social media or, you know, figuring out the landscape of what it looks like to start a business in the 21st century, or just with how to get the funding or that sort of thing. So that's one area. A lot of seniors want to start their own businesses. There is a lot of age discrimination in the workforce, and that has been a focus in the Aging Committee and a focus of legislation. I also want to piggyback on what Senator O'Mara said about the long-term care ombudsman program, which is really important, and we've done a lot to try to support it. We have a reform bill to really try to revamp that program, but part of the problem is that most of the ombudsmen themselves are seniors who are retired and doing this in a volunteer basis. This is true with Meals on Wheels and a lot of the other programs that are critical to our seniors. They are actually staffed by senior volunteers. And in the pandemic, it has been much harder to field adequate numbers of volunteers in these areas because seniors are the ones who are most at risk, and it may not be advisable for them to be doing these jobs. And so going into a nursing home is maybe not the best thing for a senior volunteer to be doing. So there are a lot of wonderful volunteer opportunities for seniors. And I know there's one in our area where seniors, senior volunteers are actually paid to or supported to help be sort of one-on-one keeping people company who are sort of shut-in seniors or otherwise isolated. But again, you know, in a pandemic, it's really hard to do that. So making sure there are these meaningful opportunities for seniors, but that they're safe while doing them, that there's PPE, that there is the kind of support system, that there's a vaccine, that there are the things that they need in order to keep doing that. This is a real priority, I think. So thanks for asking that question, Zach, because it is really important, and there are amazing wealth of activities and opportunities, and just the value to staying active is enormous. So we're looking at this from many angles in our committee.
So I'm going to shoehorn one more question into this. Hopefully we can get everybody, including you, David, in on it. Medical debt. You know, Central New York communities are hot spots for hospitals that sue patients. You know, what can we do about this? You know, we only got a few minutes, but hopefully we could get everybody in. What can we do about medical debt in the upcoming months?
I think we need.
plug the New York Health Act again, because that is how to avoid it in the future. How we deal with existing medical debt is a lot more complicated, but there is a bill to ease enforcement on medical debt during the pandemic, and that's got very broad support. So that's one option.
Got one. What else, Senator?
I think, the fair pricing issues that we talk about and not having that surprise billing, why there is such a disparate cost from somebody that's insured to somebody that's uninsured or underinsured has always concerned me. And in getting those huge bills that aren't expected, maybe we need a little more truth in advertising, or, nobody discusses costs, in healthcare. Most, patients, individuals going in for some treatment, you don't really sit and look at the sticker price and want to haggle over that. But I think there should be more equitable pricing between different insurance what's paid to different insurance companies as opposed to what's charged for uninsured.
And just to clarify, Senator May, were you referring to the Patient Medical Debt Protection Act a bit ago? You mentioned yeah, okay. Just wanted to clarify that. Who else wants to jump in on what we can do about medical debt?
I just think that go ahead, David.
I'm sorry. No, this is more important to hear from the legislators.
Well, no, I can just say that it's a big issue that's interrelated. For example, the area that I represent, medical doctors are not here, and we're trying to invite them and ask them to be a part of this beautiful community that I represent. So when we talk about what type of balance we have to bring in regards to having a discussion with all stakeholders, because when we have doctors that are not interested in practicing because of the debt that they've incurred, and looking at how we can ensure that there's optimal health care for everyone, it is so imperative that we bring all stakeholders to the table to have this conversation. As you stated, it is so important. It is so important, and we don't deserve, as the senator stated, any surprises. Healthcare, you need healthcare, you go. And you shouldn't have to sit and wonder, is this something that is going to devastate me? So we look at, it is a clear, holistic approach to determining this. And I think that our seniors are where our wisdom is, and the insight that they can provide to us because of the experiences that they've had.
So the Medical Debt Protection Act obviously is one we're maybe it's not obvious. We are strongly supportive of this. It lowers the statute of limitations and the rate on debt. It closes loopholes on surprise billing, as I think Senator O'Meara talked about surprise billing, as uniform application for medical assistance for everybody. And it gives one single itemized bill for services so you can see the total cost and only pay once. And I think the medical debt issue, I think we have to look at it through the lens of the pandemic as well, much like we have found ways to provide moratorium or extensions on rent and utilities, that this is an issue we need to look at through the lens of the pandemic as well. And the other part of medical debt is doing a better job making sure people don't get into it in the first place. And that's by lowering costs and improving quality through all the sectors we've talked about today: long-term care, drugs, telehealth. It all goes toward the cost to the consumer. And as the Assembly member said, when you get sick, you're going to the doctor. And then whether you can afford it or not, your health is the most important thing you have. So I think we need to be addressing this from both what can we be doing to make sure people aren't getting into medical debt? And then once they do, what are the things, particularly like the Patient Medical Debt Protection Act, that we can do to help them?
So just a few minutes, running out of time. I want to give everybody a one-sentence opportunity to sum up a big takeaway that they think the audience should have, once this event is said and done. What is one issue in one sentence, if you can, that you think is important for people to keep in mind?
keep family involved as long as possible.
That's a sentence. Thank you, Senator.
Reduce isolation and make sure that people are active. That's a great thing that AARP is so involved in.
The health and safety of all seniors is imperative. And look what I got today.
That's still a sentence. Assembly members, final thoughts?
Yes,
Yeah, Zach,
senior,
I think it's so important that we listen to our seniors because they've been there, they've done that, they've seen this movie before, and they are our guideposts to the future.
Yeah, just realize that you have some very good advocates, and we hear about your issues, and we do think about them, and they're high up on our list.
yes, I would just underscore that seniors are valuable members of our community and worthy of our full attention and protection.
Well, that will have to be the final word. I'm going to bring in Randy again for final thoughts. How do you think our panel did today?
Zach, thank you so much. Great panel. Zach, thank you. City and state, thank you for moderating today's Central New York State Legislative Forum. And especially thanks to all our state legislators for taking time out of their very busy schedules to speak with us. And I also have to thank all of our members, volunteers, and Central New York residents for joining us today. I hope you found the conversation informative. I certainly did. We're all in uncharted waters. The decisions our elected officials make and the policies they enact are sure to have far-reaching effects during the remainder of the pandemic and after. I hope each of you feels better equipped and informed to make our own decisions and take your own actions, which will certainly inform and impact the decisions and actions taken by our elected representatives. Thanks again. Everybody have a great day from AARP.
And before we close things out, I'm going to, in lieu of applause, I'm going to ask all of our panelists to pose for the screenshot so that we can have a great event where everyone's smiling, no one's looking down. I'm going to get my screenshot ready right now, and on the count of three, okay? 3, 2, 1. There we go. That's a good one. Thank you all to our panelists. I applaud your great thoughts. This was great. For our audience, thank you for sticking around. You know, we're going to be back in the city with a similar discussion on December 14th for our Queens Virtual State Legislative Forum with some more state lawmakers and advocates from our great sponsor, AARP New York. We'll also, and please join us the next day, 12:30, for our virtual legislators retreat, where we're going to be given all the incoming lawmakers. I think there's 43 of them I counted today. Hopefully a bunch of them will be there. We're going to give them a crash course and all the stuff that's up ahead for them. And then, of course, the next day after that, December 16th, of course, is our Responsible 100 virtual luncheon. On registration is free for all this. You can find the details in the chat. Thank you all to our panelists, the AARP, and our great audience. We'll catch you next time.
Thank you.
Thanks, Zach. Bye now. Bye, everybody.